For the people of New South Wales, freedom is on the horizon.
We're looking forward to hitting that 70% double dose in October, and it's likely that New South Wales will reach those 70% and 80% double dose vaccinations ahead of other states, and that's understandable.
Which is great, but dig a little deeper, New South Wales has had a boost. When Sydney's outbreak took off in June, the state's GPs received 32% of the national Pfizer total, in line with the New South Wales population. By last month, that shot up to 45%. A good chunk of that is thanks to
these 1 million doses of hope
that were flown in from Poland, more than half of them delivered into Sydney hotspots.
There's never been an argument from us that Sydney needed more of those Polish doses.
But revelations overnight that extra Pfizer doses were funneled into Sydney in July and August, well above per capita allocations and at other states' expense, has premiers seething.
We're talking about otherwise secret arrangements that are just not right. They're not what we signed up for, and it needs to be fixed.
It's important that the Commonwealth is honest and upfront about how many vaccines they are taking from Queenslanders to give to New South Wales.
We can't be criticised every day by the Prime Minister and Mr Frydenberg and everyone else for not vaccinating at the same rate as New South Wales when they don't give us the same number of vaccines per capita as New South Wales. It's not a fair comparison, it's not a fair criticism.
It's been reported between June and September, Queensland fell short by 100,000 Pfizer shots, WA 114,000 and 343,000 in Victoria.
I signed up to a national plan to vaccinate our nation, not a national plan to vaccinate Sydney.
But the PM's having none of it.
I don't share his view. What we need to get on and do is vaccinate.
With a further 1.7 million doses secured today, on top of the 4 million already on its way from the UK, the Health Minister says there's plenty for everyone.
Some people are looking for a fight. We're not. Sometimes these things can be a little stage managed.
Some don't like to see this as a race, but a race it surely is. What I didn't know was that Premier Berejiklian's in a sprint while the rest of us are supposed to do some sort of egg and spoon thing.
Well, Dr Nick Coatsworth is now back on the wards after having spent much of last year as Deputy CMO, and he joins us now. Nick, the Victorian government says it's 340,000 doses short. The federal government says they've gotten their fair share. Who's right here?
Well, it's pretty confusing, Carrie, when you hear those two different stories. As I understand it, there's a per capita allocation of the Pfizer vaccines, and what may have happened here, in fact, what I think has happened is that there's been an increase in that allocation to New South Wales because there's an epidemic there. And you've got to remember when you're the Australian government, you've got to allocate vaccines, you've got to stick them where the actual epidemic is. But that per capita allocation will to New South Wales will go down in the future, and it will go up for the other states and territories. That's what I think's likely to happen from the people that I've got contact with. So it's a little bit like that vaccine swap thing that's going on with Singapore and UK. We take some vaccine, but we give it back later on. I suspect that's what we'll be seeing with the states and territories here as well.
Nick, Victoria is, though, closing in on New South Wales' daily numbers. So when the next doses arrive from Singapore and the UK, should Victoria be sent more?
Yeah, well, we don't want to be waiting for months, do we, Pete? Not at all. And the other thing that we need to do is increase the number of people that can actually deliver the jab in Victoria. My understanding is that there's going to be, I think, over 700 GPs bought online in Victoria, just as there were in New South Wales, to help deliver those jabs.
So clearly Victoria doesn't have as many GPs ready to deliver jabs as New South Wales. Whose fault is that?
I don't know if it's fault, Waleed. I mean, you've got to focus your attention where the epidemic is. And now that the epidemic's, emerging in Victoria and those numbers are going up, just like we saw in New South Wales, we're going to see more and more people trained. But in terms of who does the training, yes, I think it is. I think it is the federal government, and they're turning their attention down towards Victoria now to assist that state as well, and hopefully here as well in the ACT.
Nick, you've shifted from being Deputy Chief Medical Officer to now doing clinical work on the COVID wards in Canberra. Tell us what's that transition been like? What's the mood like on the wards? How do you find doing that work?
Look, it's better. I admit I like it a bit more. I'm a clinician. I think what I noticed on the weekend was that the wards are a pretty safe place to be treating COVID now. We know a lot more about, ventilation. We know more about the potential for airborne transmission. We make sure people are in negative pressure. We've got HEPA filters. It feels like we've learnt a heck of a lot. I've, learnt a lot myself about the infection control of COVID-19, and, just paying tribute also to the nursing, the allied health and the support staff, obviously in Sydney and Victoria, as well as the ACT, really doing the heavy lifting. It is hard work being in PPE all day, there's no doubt about it, and it is taking its toll. And what we want is to see those epidemic curves start to flatten with restrictions and vaccination.
Well, Nick, thanks for guiding us through these crazy times the last few years. Appreciate your time tonight.
Thanks all. Cheers.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.